How to handle caffeine overdose. Caffeine is a stimulant that is often used to keep you awake and alert. However, caffeine is also a drug that is used in OTC and prescription medications to treat conditions such as headache, asthma, and attention deficit hyperactivity disorder (ADHD). A caffeine overdose occurs when you ingest more caffeine than your body can handle. A severe overdose, marked by difficulty breathing, irregular or rapid heartbeat, chest pains, or vomiting, requires prompt medical treatment. However, if you simply feel jittery after ingesting too much coffee, there are ways to handle this problem at home. In the future, work on lessening your caffeine consumption to avoid a recurrence. Method 1: Seeking outside help. 1. Call poison control. This is especially important if you realize you've taken a medication high in caffeine or eaten or drank something high in caffeine. Foods that are high in caffeine include things like chocolate, and beverages like tea and coffee also tend to be high in caffeine. If you have symptoms like difficulty breathing, call poison control right away to figure out how to handle the problem. The National Poison Control Center, 1-800-222-1222, in the United States can be reached at any time of day. It does not cost money to call, and you can call even if it's not a medical emergency. Explain to the person on the phone your exact symptoms and what you ingested that caused an overdose. You will also be asked your age, weight, physical condition, time you took the caffeine, and amount. Ask for instructions on how to proceed. You may be advised to force yourself to vomit or to use other medications to treat your symptoms. However, do not force yourself to vomit unless instructed to do so by a professional. 2. Go to the emergency room. If you're experiencing intense symptoms, like dizziness, confusion, an irregular heartbeat, or difficulty breathing, go to the ER right away. Do not try to drive yourself. Call 911. In rare cases, caffeine overdoses can be fatal. Intense overdoses should be treated by medical professionals. If you ate or drank something unusual that caused the overdose, bring the container with you to the emergency room. 3. Get medical treatment. At the ER, you will be given medical treatment depending on your symptoms, current health, amount of caffeine you ingested, and other factors. Talk over your symptoms with your doctor to figure out the right course of treatment for you. You may be given activated charcoal tablets to treat an overdose. Laxatives may be used to get the caffeine out of your system. If your breathing is very bad, you may need breathing support. You may also need certain tests, like chest X-rays. For more mild cases of caffeine overdoses, you may only need medication to treat the symptoms until they pass. Method 2: Treating mild symptoms at home. 1. Drink water. If you're not experiencing intense symptoms, uncomfortable sensations such as jittery feelings will pass on their own. One way to handle them at home is drinking more water. This will help flush caffeine out of your system and rehydrate your body. Try to drink a glass of water for every cup of coffee, soda, or other caffeinated beverage you consumed. 2. Have some healthy snacks. Healthy snacks can help slow caffeine absorption. Try having something to eat if you feel uncomfortable after consuming too much caffeine. Try high-fiber fruits and vegetables. Things like bell peppers, celery, and cucumbers can be particularly helpful. 3. Take some deep breaths. To slow a rapid heartbeat from too much caffeine, take series of deep breaths. Breathing in and out slowly for a few minutes can reduce symptoms right away, relieving some of the discomfort associated with overdoing it on caffeine. Remember, for severe difficulty breathing, call poison control or go to the emergency room. 4. Get active. Caffeine can actually help prep your body for a big workout. Try taking advantage of consuming too much caffeine by using it to get active. If you do a daily workout, or go to the gym each day, do that when you start to feel discomfort over consuming too much caffeine. If you don't work out regularly, try going for a walk or jog if you have time. This may lessen some unwanted effects of caffeine. Method 3. Preventing a recurrence. 1. Monitor your caffeine intake from unexpected sources. Caffeine is not just found in caffeinated beverages like teas and coffees. Certain foods, like chocolate, as well as many over-the-counter and prescription medications, may contain caffeine. You can also find caffeine in energy drinks, such as Monster Energy Drink and 5-Hour Energy Shot, workout supplements, weight loss supplements, and over-the-counter stimulants, such as NoDoz and Vivarine. If you regularly consume caffeinated beverages, make a habit of reading the ingredients list on medications and foods. This way, you can make sure you're not getting too much caffeine. Chocolates may not list caffeine as an ingredient on labels. Try to monitor your caffeine from other sources, and, if you've had a lot of caffeine on a particular day, avoid chocolate. 2. Keep tabs on how much you're drinking. Write down how much caffeine you consume each day. This can help you make sure you're not getting too much caffeine. Most healthy adults should have no more than 400 milligrams of caffeine a day, which is about how much is found in 4 cups of coffee. However, some types of coffee may have more or less caffeine than others, so shoot for a little less than 4 cups if you're a coffee drinker just to be safe. Keep in mind that some people are more sensitive to the effects of caffeine, and adolescents should have no more than 100 milligrams caffeine per day. 3. Cut back on caffeine gradually. If you find you need to cut back on caffeine, do so gradually. Caffeine is a stimulant to the central nervous system, so regular consumption can cause mild physical dependence. If you stop intake abruptly, you may experience mild withdrawal symptoms for a few days. Cutting back gradually can increase your likelihood of successfully and comfortably cutting back on caffeine. Start small. For example, strive to drink 1 less cup of coffee each day for a week. The next week, cut back by another cup. Eventually, you'll be at a healthy level of caffeine consumption. Remember, this is around 400 milligrams a day. 4. Switch to decaf. If you love the taste of coffee, soda, or other caffeinated beverages, switch to decaf. You can still enjoy the taste you love, but you won't run the risk of a caffeine overdose. You can order decaf coffee at your favorite coffee shop. You can also get decaffeinated soda at the supermarket, or see if they have it while you're eating out at a local restaurant. If you like tea, most herbal teas do not contain caffeine. Warnings. Some medications and herbal supplements may interact with caffeine, such as certain antibiotics, theophylline, bronchodilator, and echinacea. Some medical conditions require additional caution with caffeine consumption, such as cardiac disease, renal dysfunction, and seizure disorder.